Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Side effects of insulin. In the side effects of insulin, we have hypoglycemia. This hypoglycemia is actually the most common side effect of insulin is hypoglycemia. Then we have weight gain. Weight gain also occurs in hypoglycemia, and this weight gain will result in anabolic. Because of the anabolic role of insulin, this results in weight gain. Hypokalemia is common in insulin because insulin causes increased uptake, or it increases the uptake of potassium. Because it increases the uptake of potassium into the cells in the blood, the potassium concentration decreases, resulting in hypokalemia. Lipodystrophy can occur with human insulin. And one more important thing is anaphylaxis reactions are also common, though actually they are very rare recently. These anaphylactic reactions can also occur due to insulin, and these anaphylactic reactions are IgE mediated. Resistance also occurs with insulin, and this resistance is IgG mediated resistance is present in insulin. Then if you give beta blockers to a person with diabetes mellitus, then this beta blockers will block the beta receptors. Because they will block the beta receptors, they will mask the hypoglycemic side effects. The hypoglycemic side effects like sweating will occur. Like hypoglycemic side effects like palpitations, all these take help of the beta receptors, and thus they manifest. But because of blocking of beta receptors, they will mask the hypoglycemic effects, so the patient do not know that he is in hypoglycemic effect. So this is called as silent hypoglycemia is seen. Second, alcohol will also precipitate the hypoglycemia, right? And because of the blockade of beta induced hyperglycemia, delayed recovery is also seen in these patients.
thank you and thank you for watching.